there's two co-chairs today. My name is Chad Kasmar. I'm going to start with a quick explanation of who I am and why I'm here today. We are beyond excited about the level of interest that we've had today, and I love the passion, enthusiasm of our emergency communications experts and specialists in the thread so far. So who am I and why am I here? I've been employed by the city of Tucson, by the Tucson Police Department for the past 21 years. During that 21-year career, I've held a bunch of different assignments, but the last assignment, and technically I'm still with them, is a deputy chief of police, which is a second in command. We are a major city metropolitan police department, and when I started my career, we had a subset of, we were not the primary PSAP, which fell under the Tucson Fire Department, but we did oversee our own PD dispatchers. 5 years ago, we started the journey down to consolidate and stand up, and I saw Tina's comments earlier. One of the folks attending today saying, you know, she made the reference of emergency public safety communications being the third spoke in the public safety wheel, and she couldn't be more accurate, and I couldn't agree more with her. So I'll have to say that my passion point is that while I oversaw the police department's perspective of that consolidation, it was a good plan, but it was a failed implementation. So since January, I've been assigned as the Tucson Public Safety Communications Interim Director. And I have to say, from coming here and really parking my police culture I was notified I was coming over here on a Monday. By Wednesday, I'd moved out of my office and put all of my police gear in a locker at the police department and embraced my new role as an interim director. It's been such an enlightening experience for me not to have the view of emergency communications work from a police perspective, but actually as the director and having the responsibility to see the consolidation through and really evaluating our workflow from a 360 perspective. The communication folks here won't be surprised to hear me say this, but when I came over and we took over, we serve 11 different public safety partners. Tucson Police Department, Tucson Fire Department are just 2 of the 11 that we serve. And what I quickly found out as we were standing up to our own department and evaluating our workflow with our public safety partners, that my biggest and most handful department was my home department, the police department, because there's just a lot that goes into a consolidation and a separation and standing up a comm center to a full-blown department where we provide a service to, but we don't work for. So we'll dive into what that means a little bit later. But I am beyond excited to be here again. If you are interested, today is just the kickoff conversation of a multi-month project that's going to go into 2022. Please include your information and contact information so we can reach out to you and include you as an interested subject matter expert. I'll extend my offer to if you're not in a leadership position and you'll need a leader, one of your managers or leadership position to approve your participation in this project, I'd be happy to make those calls myself to your leadership team and explain what this project's about to get your approval for participation, because what we all know is across the country, we all have a very different workflow process, whether we're a consolidated or a full department, or we're working as a subset of police or fire. So with that, I'm going to kick it over to my co-chair, Mr. Ed.
Good afternoon, everybody, and thank you, Chad. My name is Edwin Huellstrounk. I am currently an emergency room nurse, but in my previous life, ahead of this, I was the director of EMS, running the second largest EMS system in the state of Illinois for 17 years. I've been a paramedic firefighter for 27 years, working in ER now for 10. And as the director of EMS, I was responsible for the dispatchers in our dispatch centers that we had and getting their education, bringing their education together. And I also bring in the fact that being on the fire side, how at least here in Illinois, we have a lot of our dispatchers fall under the police side of it versus the fire side of it. And the fire side takes second fiddle to a lot of the stuff that happens. So I think that by this transformation, I totally agree 100% that the dispatch centers should be separate and equal to all of the police and fires. They should all be on equal ground. So I'm hoping that with all this together, we can bring a new aspect of 911 to not only redo the culture of should 911 always go to an emergency room? The answer is no. They shouldn't always go to an emergency room. They should be able to take these people to urgent cares. They should be able to just treat these people and help them do telemedicine at home. So having the 911 dispatchers is the key role and the first point of entry in anything that any EMS, fire, or police do. They're the key link. That's the reason why we need to move forward and bring a great understanding to not only educating the public, but also educating our dispatchers. So with that, let's open it up and see where things go.
So again, operations. To have a meaningful conversation and an amazing, productive next 6 months of work that we want to contribute to, I want to cover a few things. Again, when we think of reform, what I certainly picked up from our emergency public safety professionals as maybe a negative connotation or directed at us that we're maybe the focus of a contributing problem. What I want to challenge you to think a little bit differently about that. I want to take the opportunity as somebody who's been fighting for increased awareness and relevancy of the work that we do, not only within my own community, but within our public safety partners, to really celebrate that this is an awareness opportunity. So the folks that actually are working in emergency communications, whether in a call processing capacity or a dispatch capacity, it matters, and you being here matters. For those that are in the community, have perspective of expectations of wanting the services, your perspective matters. For folks in the mental health community, understanding system failures that are occurring that ultimately result in calls going to 911 is critical. So it's all these amazing different perspectives that's going to create the best work product possible. And what I can tell you in the last 20 years of my public safety work, which did have embedded emergency communications work, but specifically 100% focused in the last 9 months, is I don't think there's any argument that there's opportunity for increased awareness, increased workflow, increased financial support. There's just a lot of opportunity for growth within our industry as public safety and emergency operations. So what are we here? Beginning stages of conversations to review 911 call handling operations, including incoming calls, coding, call scripts, dispatch assignments, behavioral economics, and dispatch deployment. We'll be working to assess whether and how our routine and standardized high quality call. Again, we touch base that most of our emergency communication centers throughout the country have different workflow processes. What can we learn from each other that can enhance our operations and workflow? We want to assess how related policies, procedures, and protocols enable valid and reliable information to collect about emergency support and inter-rater reliability and the efficient and effective dissemination of all that information to first responders where necessary to others. So with that being said, you're all going to have access, if you haven't already been, Ms. Haynes, if that's open already, to 2 live questions that you can type in and do online polling. So would you like me to discuss what those options and those questions are?
We're having technical difficulties. If you would just please share the questions, and if people can respond in chat, that would be wonderful while we try to figure out the tech.
Right on. Okay. So we want your feedback, and there's going to be 2 questions. The first one in the live polling is going to be, what words, number 1, come to mind when you think of 911 today? Again, question 1, what words come to mind when you think of 911 today? Question 2, when you think about call handling operations, what are the most important aspects to focus on? Question 2, when you think about call handling operations, what are the most important aspects to focus on? So I'm going to give everybody a minute to start typing in your thoughts. We're going to give Ms. Haynes a minute to kind of process some of that information and work through our technical challenges. But with that, let's do a little bit of recap of what is 911, because not everybody here is within the industry. So first, what we think about when we call 911 is actually an incoming call, mostly coming into something we call a PSAP, a primary PSAP, which is a public safety answering point. That means 911 comes into your, you call 911, you pick up the phone, and what you hear on the other line is 911, what's your emergency? Now, there's typically two different types of workflow that occurs when that happens. It's 911, what's your emergency? And then you tell them. You either have a police-related issue and it's transferred and triaged to a police call taker, or you let them know that your house is on fire, you're having a medical crisis. Most primary PSAPs across the country do have that transfer process. What's been happening the past few years and historically in some other primary PSAPs is a little bit more of one-stopping. You call the incoming call that comes into 911, which is the model that we've been working on moving towards which is extremely complex transition, is one-stop shopping, where that initial primary PSAP specialist one is what we call them, a call taker, whether it's a fire, EMS, or police-related matter, that they can process your information as a consumer of services in the community and create the call that needs to be dispatched, whether it be fire, EMS, or police-related call. So that's a little bit of the.
Chad, one of the things I want to throw in there also is the non-emergency calls that 911 takes too. There's a lot of stuff that 911 gets dumped on because no one else, the community has no idea who else to call. So that's a problem for the 911 centers, getting the additional calls that are there that they have no idea who to call. So it's a dumping syndrome for the 911 people too. So that's a third piece of it that we also need to take a look at.
Great point, Edwin. And let's really hit it home, because there's a lack of appreciation that even from often city leadership and elected officials and community of, when you call 911, you're typically not talking to a dispatcher. You're speaking to somebody who's processing the initial information and at that initial primary PSAP point, which typically is a call taking seat. Now, I'll give you an example. So in Tucson, we process about 1,500 incoming 911 calls a day out of all of the public safety primary PSAP points that we intake. And we have about 3,500 to 4,000 touch points between all of our public safety partners. But out of those 500,000 calls that we average a year, 145,000 of those are medical and fire calls. 113,000 of those are law enforcement events. So if you do math on that, that's 258,000 events. So effectively half, as Edwin just pointed out, half of the calls that are coming into our 911 emergency center to date last year are not going back out. We are responsible for filtering and connecting the right resources up to those. So it's a massively critical role that primary PSAP point of contact really has so much responsibility to connect the right resource up or to put that call. And we'll be expanding that conversation a little bit later.
And the nice thing about it is when you have a big center, you have the ability to have that one person and put it out to other people. There's a lot of people, a lot of 911 centers within the country that have one person or two people that have to handle everything from multiple departments. And they're getting all that. They do all the calls, they take and do all the dispatchers. There's a dispatch center here in Illinois that I worked with as the director of EMS that was responsible for 4 police departments and 4 fire departments, all separate, all calling at the same time. And there's only one dispatcher in the room. So taking care of all that. So very much underfunded, very much understaffed. So we got to look at everything.
So Ed, we got some great questions that we want to jump into, but let's finish just painting a little bit of the picture for those that are not within the industry to have a little bit better scope of what we do for a living. So a couple different challenges. So we've kind of covered what a primary PSAP is. As you're seeing in the thread, and again, you're hearing this, there's a variety of different ways that different emergency communications dispatch centers operate throughout the country, depending on the size and how many partners that they serve. But one thing that's universal is we're all held to NENA standards, and that's a standardized goal that we work to meet. And what that means is that's the National Emergency Number Association. And the standard that we all universally, independent of the size, irrelevant of the size that we have, is that 90% of the time we try to answer that incoming 911 call in 15 seconds. So that's 90% of the time we try to answer that call within 15 seconds, and 95% of the time we try to answer the call within 20 seconds. So that's one of the things that we're really going to have to talk about, and that's something that we struggle as we're trying to take more time within PSCD, our department. There are competing interests. We're sitting at about 45% of the staffing that we should have to run an emergency communication center of the size that we do. Many of our employees work 12-hour shifts. There's a lot of things that come into play, like compassion fatigue when you're doing something that long. But evaluating as community expectations are changing and additional resources are being embedded within emergency communication centers, specifically for mental health, those calls take more time. And for example, we can spend 5 to 10 minutes waiting to triage somebody who's in mental crisis to a mental health clinician out in the field and not dispatch a police or fire response to that. But that's 10 minutes that we're taking a primary PSAP call taker out of play. And with a finite amount of resources, that's a daily competing interest that all emergency centers across the country face, regardless of their staff size. So that's certainly something we're going to be expanding and thinking about